For decades, cholesterol has been at the center of discussions on heart disease, widely regarded as a major culprit in the development of cardiovascular conditions. The prevailing medical consensus has framed low-density lipoprotein, commonly referred to as LDL cholesterol, as the primary driver of arterial blockages and heart attacks. This narrative has shaped dietary guidelines, pharmaceutical interventions, and public health messaging for generations. However, a growing body of evidence suggests that this perspective may be oversimplified or even misguided. The traditional model of heart disease rests on the idea that cholesterol, particularly LDL, accumulates in arterial walls, forming plaques that narrow the blood vessels and eventually lead to blockages. This theory has fueled a global effort to reduce cholesterol levels through diet, lifestyle changes, and medication. Statins, a class of drugs designed to lower cholesterol, have been widely prescribed with the assumption that reducing cholesterol in the bloodstream equates to a lower risk of heart attacks and strokes. Despite these efforts, cardiovascular disease remains the leading cause of death worldwide, raising questions about whether cholesterol is truly the primary villain. Emerging perspectives challenge the notion that cholesterol itself is harmful, suggesting instead that it serves an essential role in bodily functions. The brain, for instance, relies heavily on cholesterol for optimal function. It acts as a critical component of cell membranes and plays a vital role in producing hormones, vitamin D, and bile acids that aid digestion. The body manufactures cholesterol naturally, regulating its production based on physiological needs. If cholesterol were inherently harmful, it would be paradoxical for the body to rely so heavily on it for fundamental functions. A closer examination of how cholesterol behaves in the bloodstream provides insight into its actual role. LDL cholesterol, often demonized as bad cholesterol, is in fact a necessary transporter of essential fats and nutrients. It moves through the blood to deliver cholesterol to cells that require it for repair and maintenance. High-density lipoprotein, known as HDL cholesterol, functions differently by returning excess cholesterol to the liver for recycling or excretion. While mainstream medicine encourages efforts to lower LDL levels and raise HDL, critics argue that this binary classification oversimplifies a complex biological process. One of the primary issues with the conventional cholesterol narrative is the failure to address what causes damage to arterial walls in the first place. The endothelium, the delicate lining of blood vessels, is susceptible to damage from various environmental and lifestyle factors. Heavy metals, industrial chemicals, mold exposure, smoking, and processed foods laden with artificial additives have all been identified as potential contributors to vascular inflammation. When the arterial walls suffer microscopic injuries, the body deploys cholesterol as a protective agent, acting like a patch to seal off the damage. Instead of being the root cause of blockages, cholesterol may merely be responding to a deeper problem. An often overlooked factor in cardiovascular disease is the role of excessive sugar and refined carbohydrates. When glucose enters the bloodstream in high amounts, it interacts with proteins to form advanced glycation end products, sticky molecules that contribute to oxidative stress and inflammation. These byproducts can adhere to blood vessel walls, creating obstructions that hinder circulation. This process, rather than cholesterol alone, may be the true driver of heart disease. Individuals who consume a diet high in processed carbohydrates and sugars experience increased insulin resistance, a condition closely linked to metabolic disorders such as obesity, type 2 diabetes, and hypertension. These conditions collectively elevate the risk of cardiovascular complications far more than cholesterol levels alone. The reliance on cholesterol-lowering drugs, particularly statins, has also drawn scrutiny. While statins effectively reduce cholesterol numbers in the blood, their long-term impact on overall health is less clear. Cholesterol is essential for brain function, and some researchers have raised concerns about potential cognitive side effects associated with long-term statin use. Reports of memory loss, cognitive decline, and muscle weakness in some patients taking statins have fueled debates about whether artificially suppressing cholesterol levels is beneficial or detrimental in the long run. The widespread prescription of these medications raises ethical questions about whether cholesterol reduction is being prioritized at the expense of a more comprehensive approach to cardiovascular health. As skepticism about the cholesterol hypothesis grows, alternative perspectives are gaining traction. Proponents of a more nuanced understanding of heart disease argue that lifestyle factors such as diet, exercise, stress management, and exposure to environmental toxins play a far greater role than cholesterol alone. A diet rich in whole foods, including high-quality proteins, healthy fats, and antioxidant-rich vegetables, supports vascular health by reducing inflammation and oxidative stress. Regular physical activity improves circulation, strengthens the heart, and enhances insulin sensitivity. Mindfulness practices such as meditation and stress reduction techniques can further protect the cardiovascular system by mitigating the harmful effects of chronic stress hormones. The emerging body of evidence suggests that focusing solely on cholesterol may be a diversion from more pressing concerns in heart disease prevention. The pharmaceutical industry's strong influence over medical research and public health guidelines has led to an overemphasis on cholesterol-lowering strategies, often at the expense of addressing broader dietary and environmental risk factors. Individuals who adopt a low-carbohydrate diet, minimize exposure to industrial toxins, and engage in regular exercise often see improvements in cardiovascular markers, even in the absence of cholesterol-lowering drugs. In light of these revelations, a shift in perspective may be necessary. Instead of treating cholesterol as the primary enemy, a more holistic approach to heart health would prioritize reducing chronic inflammation, improving metabolic function, and addressing the root causes of arterial damage. By re-examining the role of cholesterol within the broader context of human physiology, medical science may be better equipped to develop effective prevention and treatment strategies for cardiovascular disease. This rethinking of cholesterol's role in heart disease is not merely an academic debate, it has profound implications for public health policies, medical practices, and individual health choices. If cholesterol is not the root cause of cardiovascular disease, then dietary recommendations that advocate for low-fat, high-carbohydrate diets may have inadvertently contributed to the very epidemic they sought to prevent. The historical demonization of saturated fats, for example, has led to the increased consumption of processed vegetable oils, trans fats, and artificial additives, many of which have been implicated in chronic disease development. As new research continues to challenge long-standing assumptions, individuals are encouraged to take a more personalized approach to their health. Monitoring inflammatory markers, blood sugar levels, and overall metabolic health may be more predictive of cardiovascular risk than cholesterol levels alone. Understanding how diet, lifestyle, and environmental factors interact in shaping cardiovascular outcomes provides a more complete picture of heart disease prevention. In an era where medical advice often shifts with new discoveries, critical thinking and independent research become essential. The cholesterol debate is far from settled, but a growing chorus of experts is calling for a reassessment of its role in heart disease. The notion that cholesterol is a mere bystander, rather than the cause of cardiovascular issues, presents an opportunity to move beyond outdated paradigms and embrace a more science-based, holistic approach to heart health. The conversation around cholesterol and heart disease is evolving, challenging long-held beliefs and shedding light on deeper underlying causes. Instead of fearing cholesterol, a more holistic approach to heart health focuses on reducing inflammation, improving metabolic function, and addressing environmental factors that contribute to vascular damage. If you found this information valuable, don't forget to like, share, and subscribe for more content on health, nutrition, and longevity. Let's rethink the way we approach wellness and empower ourselves with knowledge. Thanks for watching, and see you in the next video.